Dr. Hampton Howell at Salem Plastic Surgery. Wanted to talk a little bit about BBL. That stands for Brazilian Buttock Lift. Interestingly, it's not even really a lift. It's fat injections to the buttocks. And it's a really common procedure, and it does give the illusion of a lift, so to speak, because we're reshaping the buttocks. So commonly, we'll be doing liposuction right along in here and kind of the flank and the lower back area, along with other areas, because we have to be able to harvest enough fat to be able to then process it and then use your own fat to re-inject into the buttock area to give more fullness. So it really helps to reshape, because you're not only adding some fullness to the buttocks, but you're removing above it. So it helps give more of that contour that people desire. There's a lot of that out on social media, and a lot of people who have pretty overdone buttocks, if you will, and you see that in anything in plastics, right? Like lips or breasts or anything. But for the buttocks, that doesn't mean that that's how far you have to go with it. So there's a lot of people who may have some extra fatty tissue in their abdomen or thighs that they want to reduce that, but then also enhance the look of the buttocks. But you can do that in a more mild way if that's your preference, where you're taking a buttock that's more just kind of flattened and just kind of gently plumping it up. Other people prefer much more than that. So it really just depends, like the other procedures we do, on a patient's preference and what's kind of a reasonable thing from an anatomy standpoint. So like with most things, you really just customize it to the patient and each one and just have a good discussion about it. There are some other buttock contouring things where we're actually lifting. Most commonly I'm doing that as part of like a body lift procedure, where the back side, I'm actually lifting the buttocks where the buttocks has dropped and sagged, and just adding fatty tissue like with a BBL is really just not going to be sufficient, because the buttocks needs to be lifted and actually raised. So again, depends on the person. I like to go over all that in a lot of specifics at your consultation, give you the options, and come up with a good plan together that's customized to you specifically. Hope that helps. Look forward to seeing you.